Hey everyone, and welcome back to the Life Matrix. Today we're going to talk about a really important topic: Burkitt lymphoma. It's a type of cancer that primarily affects children and young adults, and while any mention of cancer can be frightening, I want to start with some genuinely good news. With early and appropriate treatment, the vast majority of children diagnosed with Burkitt lymphoma can be cured. Yes, you heard that right. Most children can be cured. We're going to break down everything you need to know in simple, easy-to-understand terms, so let's dive in. So, what exactly is Burkitt lymphoma? At its core, it's a type of non-Hodgkin lymphoma. To understand that, let's briefly talk about your body's amazing defense system, the lymphatic system. Think of it as your body's internal security network, a vital part of your immune system that helps you fight off illnesses, infections, and diseases. It includes your lymph nodes, spleen, tonsils, and bone marrow. Now, cancer starts when cells begin to grow out of control. In Burkitt lymphoma, this uncontrolled growth begins in specific white blood cells called B cells. These B cells are a type of lymphocyte, a specialized immune cell that normally helps your body produce antibodies to fight infections. But in Burkitt lymphoma, something goes wrong, and these B cells start to multiply at an incredibly fast rate. This rapid growth is why we often call it an aggressive cancer. And it's also why a quick diagnosis and immediate effective treatment are absolutely critical for the best outcomes. Now you might be wondering, just how common is Burkitt lymphoma? The good news here, particularly for those of us in countries like the United States, is that it's actually considered quite rare. In the US, current estimates suggest that only about 1 in every 1 million children is diagnosed with Burkitt lymphoma each year. To put that into perspective, one long-term study that tracked cases in children between the ages of 0 and 14 found an average of just 21 new cases per year across the entire country. That's a very small number considering the size of the US population. However, despite its rarity overall, Burkitt lymphoma still accounts for a significant portion of all childhood non-Hodgkin lymphoma cases in the US, roughly 30%. Globally, about 800 children and teenagers in the US are diagnosed with non-Hodgkin lymphoma annually, and Burkitt lymphoma is indeed a substantial part of that group. But when we look at the global picture, the story changes quite a bit. In many parts of sub-Saharan Africa, Burkitt lymphoma is unfortunately far more prevalent. This is especially true in regions where the Epstein-Barr virus, EBV, and malaria are widespread. Both EBV, a common virus that causes mononucleosis, and malaria, a parasitic disease spread by mosquitoes, are thought to weaken the immune system, making children more susceptible to developing Burkitt lymphoma when combined with other genetic factors. In fact, in some African countries, Burkitt lymphoma accounts for a staggering 30% to 50% of all childhood cancers, making it a major public health challenge and a leading cause of cancer-related mortality in children in those regions. Looking at the global statistics in 2021, there were approximately 4,083 new childhood cases of Burkitt lymphoma reported worldwide. This is a noticeable increase from around 2,800 cases reported in 1990. The global incidence rate is estimated to be about 0.216 cases per 100,000 people, with most diagnoses occurring in children typically between the ages of 5 and 9 years old. At the heart of Burkitt, lymphoma's aggressive nature is a specific genetic mutation involving the MIC gene. In healthy cells, the MIC gene plays a crucial role in regulating cell growth and division. It essentially tells cells when to grow and multiply. However, in Burkitt lymphoma, this gene becomes translocated, meaning a piece of it breaks off and attaches to a different chromosome, typically one that is highly active. This misplaced MIC gene then becomes constantly switched on, leading to uncontrolled and rapid proliferation of the B cells. This constant signal to grow is why the cancer progresses so quickly and underscores the urgency of treatment. So, knowing all of this, how is Burkitt lymphoma treated? This is where the truly hopeful part comes in. Thanks to decades of dedicated research and clinical advancements, doctors have developed powerful and highly effective treatment plans. And the results are incredibly encouraging. Many children go on to live completely healthy, cancer-free lives. The cornerstone of Burkitt lymphoma treatment is chemotherapy. This involves using a combination of powerful medicines that work together to kill cancer cells throughout the body. The specific drugs used are often a carefully selected combination to maximize effectiveness while minimizing side effects. Some of the commonly used chemotherapy agents include cyclophosphamide, vincristine, prednisone, often a steroid used alongside chemo, doxorubicin, cytarabine, etoposide, and a high dose of methotrexate. These medications are typically administered in cycles over several weeks or months, allowing the body to recover between treatments. Because Burkitt lymphoma is so aggressive and can spread very rapidly, including to the central nervous system, that's your brain and spinal cord, doctors often administer what's called intrathecal chemotherapy. This means the chemotherapy drugs are delivered directly into the cerebrospinal fluid that surrounds the brain and spinal cord. This method ensures that the chemotherapy reaches these delicate areas effectively, protecting the central nervous system from cancer cells and preventing potential relapse there. Another incredibly important medicine in the treatment of Burkitt lymphoma, particularly in recent years, is rituximab. This isn't traditional chemotherapy, it's a type of targeted therapy. Rituximab works by specifically targeting a protein called CD20, which is found on the surface of most Burkitt lymphoma cells. When rituximab binds to CD20, it essentially flags those cancer cells, making them recognizable targets for the body's own immune system to find and destroy. Thanks to breakthroughs in clinical research, adding rituximab to standard chemotherapy regimens has significantly boosted cure rates, especially in children with more advanced stages of the disease. It's a fantastic example of how our understanding of cancer at a molecular level is leading to more effective and precise treatments. In some specific cases, particularly if the tumor is localized to one spot, for example a large mass in the belly, doctors might perform surgery to remove as much of the tumor as possible before starting chemotherapy. This can help reduce the overall tumor burden, making the chemotherapy more effective. However, because Burkitt lymphoma spreads so incredibly fast and widely through the lymphatic system, surgery alone is almost never enough to cure the disease. It's always followed by comprehensive chemotherapy to eliminate any remaining cancer cells throughout the body. When cancer cells break down very quickly, especially at the start of chemotherapy, it can release a lot of cellular byproducts into the bloodstream. This rapid breakdown can lead to a serious medical emergency called tumor lysis syndrome. This condition can overload the kidneys and cause other electrolyte imbalances, potentially harming vital organs. To prevent this, doctors provide extensive supportive care. This includes giving children extra intravenous IV fluids to help flush out these byproducts, and administering special medications like allopurinol or rasburicus to help the body process and excrete them safely. This supportive care is crucial for keeping kids safe and protecting their organs throughout the intensive treatment process. Many children diagnosed with Burkitt lymphoma today are treated as part of clinical trials. These trials are essential for continually testing and refining new, more effective and safer ways to treat the disease. It's through these trials that new drug combinations, targeted therapies, and supportive care strategies are discovered and implemented. Leading this groundbreaking work are incredible medical professionals and researchers. Some of the top doctors and institutions involved in advancing Burkitt lymphoma care include Dr. Thomas G. Gross at Children's Hospital, Colorado, Dr. Monica Metzger, and Dr. Aja Agolnik at St. Jude Children's Research Hospital, Dr. Carl Allen and Dr. Philip Lupo at Texas Children's Hospital. These experts, and many others, are not only improving care within their own hospitals, but are also collaborating internationally to enhance treatment outcomes around the world, especially in areas where resources are more limited. Major pediatric cancer centers across the United States, like St. Jude Children's Research Hospital, Children's Hospital of Philadelphia, Dana-Farber Cancer Institute, and others, work in close partnership through collaborative groups like the Children's Oncology Group. This incredible network allows for the pooling of resources, expertise, and patient data, ensuring that the latest research findings are rapidly translated into improved survival rates and better quality of life for children with cancer everywhere. The majority of this vital research is funded through governmental initiatives, primarily the National Cancer Institute, which is a part of the National Institutes of Health. Programs like the Gabriella Miller Kids First Act also provide crucial support for pediatric research. However, despite the devastating impact of childhood cancers, it's a stark reality that only about 4% of all federal cancer research money is specifically allocated to childhood cancers. This is a statistic that many dedicated advocates, patient families, and organizations are passionately working to change, striving to ensure that children receive the research funding they desperately need and deserve. Now let's address one of the most important questions for any family facing a cancer diagnosis. When is a child with Burkitt lymphoma considered cured? After completing the intensive treatment, the first major goal doctors look for is something called complete remission or NEED, which stands for no evidence of disease. This means that doctors cannot find any signs of cancer on imaging scans like CT or PET scans, in blood tests, or in bone marrow biopsies. Achieving NED is an incredible, hard-won milestone for both the child and their family. However, doctors are typically cautious about using the word cured immediately after treatment ends. The general consensus among oncologists is that most children with Burkitt lymphoma are considered cured if they remain in complete remission for 5 years or more after finishing their treatment. This 5-year mark is significant because if Burkitt lymphoma is going to return or relapse, it most commonly does so within the first few years after treatment concludes. If a child remains cancer-free beyond this period, the chances of recurrence become extremely low. In some specific cases, doctors may wait even longer than 5 years before definitively stating a child is cured, depending on individual factors and the child's specific condition. Ultimately, a cure for Burkitt lymphoma means more than just a period of time without disease. It means the child is healthy enough to have the same life expectancy and quality of life as any other child their age, without the ongoing threat of cancer. Even after being considered cured, children who have undergone Burkitt lymphoma treatment will have regular follow-up visits for many years. These checkups are vital for several reasons. They help monitor for any potential rare return of the cancer, but just as importantly, they allow doctors to check for any long-term side effects from the intensive treatments. These can include issues with heart function, kidney health, or even concerns about future fertility, all of which are carefully monitored and managed to ensure the child's long-term well-being. And here's the absolute best part, the most hopeful message we can share today. Thanks to incredible advancements in diagnosis and treatment, more than 90% of children with Burkitt lymphoma are cured with today's therapies. This is a remarkable success story in pediatric oncology. With the right medical care, timely intervention, and ongoing support, most children go on to live full, healthy, and happy lives. Thank you so much for watching and for taking the time to learn about Burkitt lymphoma. If you found this video helpful or informative, please hit that like button. Subscribe to the Life Matrix for more content like this. And most importantly, share this video to help spread hope and awareness about childhood cancer. Remember, every child deserves a future free from cancer. Take care, and we'll see you in the next video.